And doctors may have to pay fines too if they take Medicare patients and don't have the right electronic medical record system. That system costs thousands of dollars.
So some doctors are opting not to take Medicare patients. And as Christy Myers reports in tonight's Health Check, other Houston doctors are choosing instead to just close their doors.
Good morning.
Good morning.
Hi, Teresa. I'm Dr. McWilliams. I went into medicine to make a difference in people's lives.
But Dr. Robert McWilliams says he's going broke.
I haven't paid myself a salary since October 2010. It's the last time I took a dime home from my 40-year practice.
Medicare, Medicaid, and insurance companies are paying doctors less. Dr. McWilliams says for 2 years he's lived on his savings because it takes all his income to pay staff and run his office. Dr. McWilliams sees more than 5,000 patients a year, and he'd hope to continue seeing patients for another 5 years. But he says the changes in the Affordable Care Act that are coming have been the last straw.
It's going to be run by bureaucrats and it's going to be run by politicians who have no idea what is in your best interest. Then I'm getting out.
He's not alone. Other doctors are beginning to close their practices, worried about the Affordable Care Act, which goes into effect in January.
If you add millions of 20 million, 50 million Medicare patients to the system, but you have no doctors to take care of them, what good is the system?
Dr. McWilliams plans to retire early and close his practice in February. Many of his patients don't know yet.
Because we're going to have to do a lot of explaining to the patients as to why we'll be closing.
I don't know what I'm going to do. That's really upsetting because he's the best.
Closing, though patients and staff alike don't want to close. But Dr. Robert McWilliams says he can see no other way out.
It's going to hurt me, but it's going to hurt for the patients more. And the patients need to realize that.
Christy Myers, 13 Health Check.